impacts every human being, quite like child abuse. The Center for Disease Control, United States Department of Health and Human Services, has done 25 studies since 1998 documenting we can't get a handle on any social ill in our country until we get a handle on child abuse. Kids who are abused are more likely to suffer from heart disease, liver disease, cancer, a wide variety of medical conditions, as well as a wide variety of mental health conditions. They're more likely to have a tough time holding a job. They're more likely to be poor. We can't get a handle on any social ill in our country until we get a handle on child abuse. It's the feeding system for most, if not all, social ills in our country. So those who say child abuse doesn't impact them, they just don't appreciate how widespread abuse is and how many things filter out from it. According to one study, child abuse is 10 times the rate of cancer. And everybody listening to this knows at least one survivor. And if they don't know who that person is, that's because their family members, their friends haven't felt comfortable enough to talk to them about their own abuse. But once folks are educated, they feel comfortable talking about child abuse, others that they know will share their experiences. We've all been impacted by child abuse. We may not appreciate it, but we all have been.
Training is what's so important. Getting the information out so that people do understand it does happen. Don't think you're living in a bubble. You know, people have said to me before, I'm so glad this doesn't happen in my neighborhood, and I'm thinking in my head, working a case in your neighborhood, you know?
The center really began over a conversation in Winona. I was working for the NDA at that time, and I was in Winona for the Christmas holidays. My wife Lisa and I were having dinner with Jim Schmidt and his wife. And his wife is a nurse, and she was telling us how she helped a doctor deliver a baby, and the mother was a survivor of sexual abuse. They didn't know what to do. The baby almost died. She said after that she read of some research about this phenomenon of what a medical provider could have done. And she said, boy, I wish they'd taught me that at the undergraduate or graduate level. And I said, there's nothing you learn, absolutely nothing at the undergraduate or graduate level that prepares you for a career in child protection. And Jim Schmidt questioned me about that, wondered about that. After an hour or so, he realized it really was true. So Winona State wanted to partner with us to design a model curriculum. So they partnered with us, the National District Association. We got a congressional earmark that went to Winona, and that began the center. The original vision was not a building in Winona, it was just the development of undergraduate training. The idea of the building came about because Darrell Kruger, the president of Winona State at the time, was visiting us in D.C., and he was at our NDA offices, and he saw a picture of the National Advocacy Center, which is a federally funded training complex on the campus of the University of South Carolina. And I said, well, there's a good example of a federal state university partnership. And he thought about it for a minute, and he said, young man, I could build you a building, what would you do? So we very quickly expanded the concept into a training facility that would be ideal for the undergraduate curriculum, but also could host a small intensive training for professionals in the field. We're the only national organization in the country that has as its goal ending child abuse and back it up with a concrete peer-reviewed plan to get there. So we have multiple programs. We have the core center, which provides training, technical assistance, publications for professionals in the field. We partner with Corner House on forensic interview training initiatives. We have the Jacob Weatherly Research Center, the Center for Effective Discipline, a whole host of major national prevention initiatives. We work with several universities, Winona State University, Northwest Arkansas Community College, and others to reform training on the undergraduate and graduate level. And every single thing we do fits under the umbrella of that paper. Every single thing we do has one thing in mind, which is to move the country forward to the eventual ending of child abuse.
I have a 24-year perspective as an attorney and almost 20 as a prosecutor. And to have this center in Minnesota is a point of pride that I can brag about to my friends around the country. And to have it as resources when really You know, we have 87 counties in Minnesota. I can only speak for Minnesota. And only 7 of them, the metro counties, really have the resources to do this without the Winona Center and Victor V's folk.
With them that allows us to not only work with professionals who are already out in the field, to bring them into our center and provide them with some very hands-on, very intensive training that we can bring. But we can also take the benefit of our physical space and the faculty, the staff that we work with from NCPTC and carry that over to Winona State. So the students that are coming through the programs, the students that are learning to be our future doctors, our future investigators, either for law enforcement or child protection, our nurses, our educators, all of those folks get the benefit that the professionals that we're teaching now never had when they were going through it. So they get to see and use the programs. They get to use and practice interviews within our forensic interview rooms. And they get to go to the mock house. They get to walk through it. They get to see firsthand what it might be like the first time that they open a door when they have to respond to a child who's being victimized, who's maybe witnessed violent crime, who's being sexually abused or physically abused or neglected. They get to walk in that door and look at what it might be like when they first walk in their first case.
I'll tell you, Arkansas is very busy, and we're very excited to get into our new training center and to provide those resources for the southern region of our nation, continuing to create advanced trainings. That's a big focus of mine with regards to forensic interviewers, to provide them those tools that they need when they're in the room talking to the child.
Every time I will email anyone over there, they will respond back. One of the attorneys there I know had done research and sent it back to me because our guys just didn't have time to do it, and I called and just said, hey, we need help. And they are always there. They're always there to support us, which in turn allows us to support the people that we're training.
If it's a child abuse case, a sexual abuse case, I go and call the center in Winona. I get answers from them. I get arguments, sample briefs. They are my good right arm when I have to do a kitty sex case in particular. This case where a child is a victim. Those are far more complicated. In fact, you know, I've tried murder cases and kitty sex cases. The murder cases are actually easier because there's much less, there are far more issues involved. There's one case in particular about 3 years ago where I had a judge who was not well versed in these types of trials simply give me an ultimatum at lunchtime. He says, hey, there's a piece of evidence I wanted to introduce. He says, if you don't have case law by 1 o'clock, I'm not letting that evidence in. And I quickly called Victor Veith and talked to him and Amy Russell, and within about 50 minutes, 55 minutes, they provided me with 2 cases and a short summary that someone had done in a law review article. There is no way in that limited amount of time I could have done anything with what we have in our tiny courthouse. And the evidence was let in, the child rapist was convicted, and I have no doubt he would not have been had it not been the help from the center in Winona.
If you give your money to direct services and those direct service providers don't have a clue about the dynamics of child abuse, if they don't have a clue on how to recognize it, how to report it, how to respond it, how to work with the survivor, it's money that will have no impact, at least no significant impact whatsoever. But if you fund an organization like our center, which trains those who work with the children how to do it properly, you'll have a much bigger impact. It's the old analogy of you can give somebody a fish, you impact that one person. You teach them how to fish, you impact them forever. We're teaching people how to fish. How do you work with kids? How do you help them? How do you move them beyond the abuse if you can't stop it? And how do you stop it to begin with? So we're having a much more transformational impact on the country.
Prior to getting into the area of child sexual abuse and family violence, I never wanted to believe it existed. And so I can relate to those families that come to us and say, I can't believe this is happening, what do we do, help? And I think through this training and through the experience that we are able to provide a safe haven for these families, an outlet, a voice for these children and for the non-offending caregiver or their support system, so that they know that they're not the only ones that have experienced this. We've extended our hand in regards to counseling resources to help them, because it's not just a week process, it's a lifelong. And so to involve ourselves in their life, or put in place outlets for them, places for resource, at the end of the day helps us feel like we're doing a nice job, and it helps the family know that there is a tomorrow.